I think you can, right? Great. And then I'm going to have you come about halfway up, and I can guide her a little bit, about right there. And then what I'd like you to do is just bend your elbow for me as far as you can go. You're going to bend your elbow. Yeah, bend it. Yeah, bend it all the way. I didn't say flex because I didn't think she'd know what flex would mean. I thought she might know what bend is, but she doesn't, so I would just say, hey, we're going to go this direction. Can you do that for me? Okay, can you bend that down? How can you straighten that arm out all the way for me? Nice. Very good. So now what do we know she has? She has at least a 3, right? Okay. And what are we testing? Which muscle? Tricep. So now I'm going to ask her just to bend just a little. And then I'd like you to hold it there. Don't let me push your arm anywhere. You're going to just fight against me, okay? Do you understand?
Yeah.
Are you sure?
Yeah.
Okay, so hold it right there. And she doesn't give it all, so what do we give her? 5. And she's following my commands much better now. We're communicating a little bit better. And then I would do the other side. So I'm going to go ahead and lift that other arm all the way up and then come about halfway. And then remember, we're going to bend. And I can always demonstrate if I don't think she knows what bend means. And then I'm going to ask you to straighten that out all the way for me. Good. But I'm going to be on the other side, right? And then I'm going to bend here. And then I'm going to have her hold it there. Yes, Sarah.
So you bend inward, not back.
She's lying down, so it's kind of hard. I don't know what you're asking. Like
same
back
motion.
here.
Like this when we were doing the demo
Yeah,
earlier.
so like here, in order to get gravity, I have to have her be right here. If I have her do it from back here, it's not going to work when she's lying down. Am I incorrect in thinking that?
Like
no,
this.
No, I just meant
No,
like
she was sitting down.
laying down, like going.
She's doing this.
That way your arm is.
No,
Yeah.
she should be this way.
Is it?
Okay.
Absolutely, I understand that, what
Okay.
you're saying.
Okay, sorry.
So we really weren't following each other very well, as I'm talking, I'm not paying attention, so, yes, tricep. So what's the difference going to be if I did it here?
It's in a different muscle.
Am I?
No.
Not really.
I'm not sure.
It's just not against gravity as well, okay? This is a given position, okay? And if she's, can't go all the way up, it's not going to matter as mature, she should be able to go to 90 degrees of flexion, right? Okay, what's next? We've done grip, we've done scapula, we've done triceps, or quads. Am I going to do this leg? No. I'm putting it on the table, this guy. Okay. This is the wrong side. You safe? Okay.
Feel safe
And it's okay to leave the table up because I have, or the bed up because I have the rails and I'm just walking across, around. But once I leave, is it okay for me to leave the bed up?
Even with the rails up?
We really need to order new hospital beds. Maybe we'll get some grants. So now I have to check this, so now I can check her other side as well. Okay? For your practical, you will probably only need to do one side, but practice both for now, so you can practice going up and down, and maybe someone can get some WD-40 and fix these guys. Okay, so same thing. We've done her grip already. She's already done her tricep. We've done her scapular depression, so now we're just going to do her leg. So she's in bed, so how am I going to do gravity with her being in bed? What do you think? So I'm either going to raise this up a little bit more, or I'm going to come under here, and I'm going to just bend her a little bit. You okay like that? Mm-hmm. And then could you just straighten that leg out for me now? Straighten your knee out. Yeah. Hold it up and tell me how that feels. Okay? Mm-hmm. And then could you bend it just a little? Okay, come back up. And then I want you just to hold it there for me. Don't let me push it down. Excellent. Very strong. So she's going to be able to, she has a 5, so she's going to be able to put most of her weight on this because she can only touch down on this side. So we want to make sure this leg's pretty strong. Okay? Is that okay? All right.
Is there other ways for you to do the quad test?
Sitting up. Just sitting up. Yeah. Yeah. And the one exercise we talked about was just the quad set where she tightens this muscle up and holds it for a count of 10 and relaxes. You could also have her roll a pillow under here, and she could do just what she just did for me. We call it a short arc quad, where she just lifts it off that pillow, and then she lets it come back down. She holds it up there for about 10 seconds, and then she slowly lets it bend back down. Let it come back down. Just bend. Pretend like I'm a pillow here.
Oh, okay.
So if I had a pillow or a towel roll, I usually roll up a couple towels, and I leave it there for the patient to have so that the nurses can even give it to them as well. So if they can be doing bed exercises during the day, so they're gonna get stronger that much faster. So she's gonna bring it all the way up, tighten that muscle, count to 10 for me, don't forget to breathe. When we hold our breath, you know what happens? Then we don't have any blood go to our brain. We don't want that. So really important for you to breathe. You can even count out loud. That make sure you have that air exchange to your brain. Okay? And then when you go down, you don't want to plop. You just want to slowly lower it down. Okay, so go ahead and lower it.
Like these are exercises?
Yeah, so that would be called a short arc climb. Okay? That's really not part of this class, but look at it. All right, so now we're ready to get up. You ready to get up?
Yes.
All right. Me too.
You're going to have a lot of fun with this because I have really bad coordination.
Yeah, that's good. We love patients like that. So what's the first thing I need to do? So before I load the bed, I'm going to actually take this pillow out while my body mechanics are still good and I have the bed here. So I'm going to lift your leg up. Remember, she's had surgery. Okay, so you ask her, can you lift your leg up? You tell me. Can you? You might be able to. It's up to you.
No, I
No,
cannot.
she can't. Okay, so if she can't, but always ask them. And then I'm going to just slowly bring that down. So I'm supporting that the whole time, okay? But a lot of your patients can lift it up. Ask them first, okay? Or you can help them a little and they do most of the work, okay? I'm just going to set that over there. Is that okay? Now we're going to lower your table. And often in the beginning you don't know which one is which, so just make sure you do so you're not like pulling their leg up and really hurting that poor leg by putting the leg up. Now, obviously, it would be easier, right, if I put the head of the bed up and she could just sit up. So why would I not do that as a physical therapist?
To see if she can do that.
Is she going to have this at home? No. So this is a pet peeve when my mother-in-law was in. Oh, yeah, she can get in and out of the bed all by herself. Well, yeah, they put the bed up for her. Yeah, they have the things. Can't do that at home. So as therapists, we do them a disservice if we do that. We really want them to try and do most of it themselves. We can be there to help them. So here's our dilemma. She's going to need shoes, right? If I put her shoes on now, what's going to happen? What am I infecting? Dirtying the bed. So if I wait till we sit up, what do I have to worry about? Her balance. So you have to just, yeah.
So you put the socks on?
You put the non-skid socks on if you didn't have shoes, but you really want shoes, and you have to wait to put them on until they're sitting down. So I will show you how to do that, but just so you know why we don't put them on the bed. What would be an alternative that would be safer that I do?
Put a towel under there.
Exactly. Just put a towel under there. Put their shoes on. Throw that towel away. Once they come back into bed, you leave that towel there till they come back in bed. Once you take their shoes off, you put that towel and you put it in the dirty one. Okay? Problem solved. Good job. So she's way over here. So what am I going to have her do?
Scoot to the edge.
She's got to scoot towards me, so I'm going to ask her to bend this. Okay? And then you're going to push with those nice, strong scapular depressors, and you're going to just scooch towards me. Yeah. Scoot yourself. And I may have to help her with her leg. Good. And now we're going to go ahead and sit on up, okay? So you ready? I'm going to take your leg. You're going to use your arms to help push you up, and we're going to swing on over. Okay? And there she goes.
It's just my ankle, right? Not my knee.
It's just your ankle. There you go. Yeah. Yeah, how you feel?
Good.
Good? Dizzy at all?
No.
No. Oftentimes they are. They're getting up. Well, remember people who have low blood pressure, they're hypotensive a little bit. So this is the other thing. Sometimes you have to check their vitals, but oftentimes they've been checked by the nurses a million times. So if you go at least look in the chart and see what their norm is, then if they are a cardiac patient, you're going to monitor them before, during your exercise, and after. Okay, so you'll know in certain situations you're going to be checking their vitals. Okay. So now what I'd like to do is have you scooch just a little bit so your feet are touching the ground. Okay. Right about there. Good. All right?
Yes.
So I'm guarding her the whole time. We're going to put this gown on you so you don't get any fresh air back there when we're out walking the halls, okay? There you go. Okay. Good?
Yep.
And then have my teeth part that I'm gonna put in first. So I'm gonna bring this around, excuse me. Jen, I'm gonna just reach around you. This is just for safety's sake, okay? So the teeth part go in first. We're gonna cinch that nice and tight. Can you breathe?
Mhm.
Okay, good. And then I'm gonna put it in here. And make sure. And then when she goes to get up, I may have to readjust that again. Okay? Can somebody grab me her shoes since we didn't put them on? Good. So I would have had to put her back in bed. Okay? All that good stuff, but we're not going to have any time to practice today. I'm sorry, you guys. We have an hour.
This is helpful.
I think we're done at
11:50, so we have an hour. And she's very agile. She can get that.
No, I'm like just trying to do it.
She can get that in
Time
there.
safe.
It's amazing that she can get
Time
that
safe.
ankle in that shoe already. That's pretty impressive. She's going to be out on whatever she likes to do pretty quickly. How you doing there?
Good.
Good. So what did I forget?
Bring the walker close.
Probably should have had it a little bit closer. I can still reach it though. Shoo. But you're right. Make sure everything's clear. That I have a clear path to wherever I'm going. All right. So now we're going to put this right here. So now before you do anything, this is the other thing I should have done before I got her up out of bed. What do you guys think? It's something I said that you guys need to just do for the patient before you actually did the gait training.
See if they knew where
You're going to demonstrate for them. So we're going to assume, get yourself back in bed, just pretend that you're in bed. She's not sitting here, okay? Don't really do it. So I'm going to just show you first how we're going to do this. I know you did this yesterday, but I'm just going to give you a review, okay? Remember that you're really not putting any weight on that ankle yet on that left side, all right? We need that to heal. The surgeon wants you to not put any weight. You're just kind of basically touching your foot down just for balance, okay? So what you're going to do is you're going to bring the walker first, okay? And do you remember which leg goes next? So I can test her because she's been showed. So it's going to be your right or your left leg. You're not going to say affected. You're going to tell me which one.
The left one.
Yeah. And are you going to put a lot of weight on that?
No.
No. So your weight's all going here, right? And you're just touching that down as you walk through with your right leg, okay? And it's going to be walker, very light. And I'm going to put my foot under there for a couple of times just to make sure you're not putting too much. And then you're going to let me know if you have any more pain with it as well. Okay? Any questions on that? And then when we go to get back, we're going to sit in the chair for a couple hours, and nurse wants you up for lunch. So then we're going to walk backwards. So you're going to walk back actually with your right leg, okay? Left leg, and then your walker. Okay? So it's going to be right leg, left leg, and walker. Until your legs feel the back of that chair. Okay? So keep going. I don't feel it yet. Man, it's way back there. Huh? Starting to feel it. Oh, there it is. Okay, and then what I'd like you to do, I will help you with your left leg, but you're going to reach back here for the chair to make sure you have something stable, okay? And then we're going to slowly, I don't want you plopping like this, okay? We're going to just come down nice and easy, just like so. And then we'll get your little table, and you can watch your TV shows, and lunch should be here before you know it. Does that make sense? Any questions or concerns with that? Okay.
Let's do this.
All right, so let's do it, man.
So that was before. I
So that was
did
before
this.
anything. I
Okay.
just came in, I'm going to demonstrate, because what happens if I wait till here and I'm leaving you?
Falling over.
So I wasn't thinking ahead. Hate when I do that.
Fail practical.
Failed it. Failed it. Biggie. Okay, so now she's here. What do you think? Should her hands be where she has them? Probably not.
She
Why
should be
not?
on
So she's going to put her hands on either side of the bed for me, please. And then what I'd like you to do is, we're really not going to put any weight on this side, so I want you to bring this leg out for me, okay? And you're going to put this leg back just a little bit so it feels comfortable, so you have some effort. I want you to do as much of it as you can. On the count of 3, you're just going to do your nose over your toe, okay? So you're kind of bending like this. You can do it a couple of times, and on the count of 3, we're going to stand up. 1,
She's at the count.
2, and 3, and up you come.
All right.
So she's a minimal assist. So what do we remember what number that is?
3.
Sorry.
2.
It's a 2.
It's a 2, you're right.
Is it a 2?
Yes, it's too.
Are you sure?
If it's total, maybe
I think
the
it's
max.
a 4.
I think it's a 4.
Oh, is it 4?
The higher up you go, the better you are.
Oh,
The
total
more
max.
independent you are.
Total-
3
alright.
is mod.
Let's do it. Let's do it
50%,
again.
right?
And 4 is, so since I have her here, let's just see how she would get back into that bed. So go ahead and, you're gonna do just the reverse, so you're gonna come back with your right leg. Is it touching the bed already? No, so go back with your right, and then with your left, and then with the walker.
I
Okay?
can't really.
That's about it, you're there,
Okay.
right? Yeah. So now you're gonna reach back for that bed. So with her, I probably would have raised the bed a little bit. And you're gonna bring this leg out.
What are we doing?
I'm gonna sit back down.
Oh, okay. Bring
Yeah.
this leg up.
This leg, and this leg's coming back to reach, and I'm
Okay.
really controlling her.
Okay.
She's gonna wanna hold on here. I'll come back up and do it with holding on so they can see why that's a bad idea. So go ahead and sit down.
I was gonna do that.
Yeah, just sit down.
Good.
And you see what happens, and she flops also, okay? Yeah.
So
Okay,
she
so
has
let's
to
get
lie.
back up and do a little walking.
Okay.
So let's do a 3-point gate. Okay, so you're gonna do the walker first.
So are we turning this way?
Yeah, we have to kind of turn because we're
Okay. So it's divide.
Okay. And then I want you to put your foot on my foot, okay? And remember, you're
Here
just
or here?
right on my foot because you're just gonna walk like eggshells.
And then here.
Very nice. And then the walker. My foot gets in her way a little bit. Let me get my foot out of there. Okay. Good. And I'm gonna lift my leg up because you're doing a very nice job. I don't need to check anymore. And then if I wasn't sure also, I can palpate back here to make sure she's pushing with her elbows as well. Walker. Good. Left leg, right
do it?
leg. Yep,
Did
let's
I
go
do it
one more. Walker.
I'm just
And
gonna
then you think
exaggerate
she's
it.
going a little too far with that walker. So what happens is, and then you have to direct them. They tend to want to go way out here, and then what's that going to do for her? Yeah, so you have to
Let's
kind
try
of-
it. Let's try
And then,
it.
do you see where her feet, how her
I wanna
narrow
see
base
what
of
happens.
support she is? So I'm going to ask her to spread her feet out. So these are all your cueing things. You're going to have her be up nice and tall. Good. And let's walk one more step. Walk her first. And going out about, not quite so far. So about like that.
Right here?
Okay? Yeah, just a comfort arm width. Okay? Good.
Perfect.
Excellent. Now we're going to start turning. And because there's a wall over on that side, today we're going to have to turn towards me, which is your weak side. Okay, so go ahead and turn this way. So we're going to take the walker. You're still going to move that left leg first. I have this here just in case because now she's turning. And this might be the area where she might lose her balance more often. And then the walker.
Okay.
Now if I had to help her with that walker, moving it, what kind of assist would that be? Go ahead and walk her.
Max.
Probably be mod, because I'm helping you a
Where
little
am I-
bit. So
where
what
am I
number is mod?
3.
3. 3. So make sure you guys know those. Okay, walker. Left leg, right leg. So even if she could do this all by herself because she's extremely slow, I would put her as a 6, a modified independent. If I had my hands off of her and she was just doing this, she's not very fast, so I would say that she needs a little more time before she feels totally independent. So now I'm going to keep my hands off of her. I'm going to see how she does. I'm going to just guard her. So go ahead and turn left towards me. You're going this way still. Yeah. And so this is really important because she's having to think. It's a lot to think about. She's not quite sure what left means. So then I'm going to kind of visualize to her. I'm still kind of guarding here, but now what assist am I giving her?
Cueing.
I'm doing cueing, so what would that be? Supervision, right? So that's a 5. Okay, and then she's going to go sit in the chair now. No, not yet. You're too far away. We're only going to go backwards once you get to the chair.
So
Then
this is 3 points, right?
yep, 1, 2, 3.
What is the
1, 2, 3. You really can't do 4 point with
Okay.
walker, okay? So 1,
Where do I turn?
2. So good question. Should she wait till she gets to the chair to turn? No. She wants to get, this is probably a good radius, the radius of your walker. So this time we can go to her strong side, okay? So go ahead and start turning.
What was I
Your left leg's always going to go first, okay? Always going to go first, yeah. Because you're putting most of your weight, Jenny, on your walker and your right leg, okay?
Now I'm going backwards.
You're not yet. You got to turn all the way, okay?
Oh, wow.
keep coming. And she kind of,
I forgot what leg.
she's kind of a little far away from her chair now, isn't she? So that's a good thing, because now we have to teach her how to scoot to the right. Okay, so now, Jenny, just because we're not quite where we want to be,
Okay.
I'm going to have you bring your walker this way. So we're going to pick up your walker and go just like this, just a little bit. And I want you to bring this leg over, using all your pressure on there, and make sure you're not putting any weight on that other
Side
foot.
stepping?
Or side stepping.
Okay.
Okay, good. So I'm back guarding her on the right side again. And here I might be a little nervous about how much weight she's putting, so I'm going to ask her to put her foot on my foot again just to double check her weight bearing. Excellent. Good. Back. Now we can go back. We're a little bit far, but I think it's good practice for you. Okay, so what you're going to do now is just the opposite. You're going to go back with your right leg. That's your right, and then now with your left. And
Is
then
it
you're
still
going to
like
bring
walking
the
on
walker.
eggshells?
Yes, you still no weight bearing on that. Okay, and so right leg, and then I'm put my foot under there this time. Make sure you're not putting too much weight on
Good.
that.
I'm not. Promise
You
you.
are. You are. You're doing a very good job.
Okay.
She's doing a really good job. I feel absolutely nothing on my toe. So now
Okay.
that time you put back your left leg first. So let's bring it back. Just let it kind of be right there. Yeah, and then bring that right one back first, and then your left. Are we touching the chair yet?
Yes.
Good. Okay. So now, remember we talked about,
Okay,
you're going to
not
bring
nothing down.
this leg forward a little bit because we don't want to put any weight on that. And you're going to reach back with both arms for that chair. Okay?
With both arms?
I got you right here. I promise.
So I did like this?
Mm-hmm.
Okay.
And then you're going to slowly sit down using that right leg and your arms to help you.
Okay.
Okay? Nice.
Workout.
Yeah.
Fun.
So what kind of assist did I have to give her with her transfers? So that was a transfer, that stand to sit, getting in and out of the bed. I would say that we had to do a 3, which would be a mod assist. She's helping me quite a bit, but I'm also helping her. We're about 50-50 there. Max would be I was doing most of it, and she was doing a little bit. Okay. And there's always that fluctuate because you have 49 versus 50, so you know you're going to have that fudge. So you just kind of know that that person who's right around 50% is going to be the mod. Person who's below that, more like the 40 to 25% is going to be more the max.
Are you going to ask us that on the practical?
Oh yeah, and you're going to document it.
Like what kind of
Assist.
assist
Mhm.
is this?
So assist with the transfer and then assist
Or
with
two
getting-
separate, yeah, two separate things. Okay, any other questions? At least does that give you guys enough to, so if this walker had been too tall or too short for her, I probably would have put her in the chair, or I would have lied her back down so that I could adjust it, okay? And then move it back up, all right? And don't forget about washing your hands. And then with her, if I'm leaving her in the chair, what do I need to leave with her? Call button, I need to put that table, make sure she's safe. I only put her in the chair if it's been, so that it's okay for her to be up, that her balance is okay, that she can, I let her know that she's not allowed to get up by herself unless we've cleared her to get up by herself. So then what do I do with this? I get rid of that so she's not tempted. I put her bedside table up there, I give her the TV thing, and she's good to go. She's tired. And then I ask her what?
How you feeling?
How's your pain?
The pain med has kicked in now.
So what was saying?
It's about a 2.
It's about a 2. So she went a little farther today. Her pain is good, so we'll definitely make sure that she has those pre-med. We'll continue with making sure she has those for the next couple of days until she goes home. Our plan is to make her independent. Okay, so we're going to give her a few more exercises to do in bed, maybe work on her balance a little bit, and work on cueing. And the unfortunate thing about the pain meds is they make you a little more confused. So sometimes you have to weigh the two. Is she more safe with or without, and can she tolerate without? Maybe they can just give her Tylenol instead of a heavy-duty pain med, or a half of a pill. Something like that. So you can kind of play around with that a little bit if you feel like you're getting too foggy. So then I'm going to take her gait belt off, because I need this for my next patient. And we won't even talk about the germs that we share with that. But hopefully we have clean gowns. And then I'll leave her gown on until she goes to go back into bed. And then when she goes to go back into bed, obviously go ahead and come on over here. I'll just show people how that works. Man, look at her, she's such a good patient. So don't sit down yet, please. So I'm going to take her gait belt off, take her gown off for her before she sits down. Okay. So gait belt.
Should I be having a walker?
Put my, yeah, you got the walker. I put my gait belt back on. I let her sit back down. So that's option number one. Okay. That's for the person who doesn't want to have to deal with them sitting on that. What I do, go ahead and come on back up. Put this on. Look. She's got her gait belt on. I have her sit down, but I do this. I sit her down. I just pull this one up, and down we come. Legs out. Take off my belt. Now I can take that gown off without having to fuss with it sitting on her.
I still kind of sat on it.
You did. See, I didn't pull it up quite enough, but that's okay. We're still not too bad. And then we're going to help her get back into bed. So obviously we put her way down too low. So there's two options I could do. I could either have her scoot if she was strong enough with her good leg and scooch this way.
It's 2 now, so I'm feeling it.
Yeah, so she's working. And then when she goes to get back into bed, okay, I'm going to take this, we're log rolling down, rolling in, and then I've already taken her shoes off. All those things to remember. Man, it's been a long time since I've been in acute care. There you go. Okay, so we all have to remember those things I forgot. Okay? Round one. Obviously, I didn't practice this ahead. Shame on me. Okay, but it's like, don't we say that we do it wrong when we do it right? Yeah. Exactly, exactly. You all have it recorded. Make sure on your recordings you know that you took your shoes off first. Okay.
Okay.
All right. Remember that, Deja.
Yeah.
Have that come back to bite you. All right. All right, you guys ready? So I have scenarios for you. Thank you. You're a very good patient.
Thank you, Jenny.
And you guys just remember with the gait belts there is a trick. So, all right, and then you go. All right. Or it goes in the T side so that it can move. Okay. Versus this way. Okay. Keep that. Okay. Pac-Man side. All right. And then what will happen is that person who is